What's up, everybody? Welcome to the Better You Project, optimizing health, hormones, and aesthetics. And today I have I'm like fangirling over here over the guest that I have today. I have Dr. Izabella Wentz. She is a clinical pharmacist with a passion for healthcare. She's a mother, she's a daughter, she is all of the things. She is very knowledgeable when it comes to a very common condition that we deal with at UDirect Health, and really a lot of women deal with in general. And it's a condition called Hashimoto's disease. This is an autoimmune condition, and we're gonna jump really deep into some of the things that I wish every patient knew about Hashimoto's disease. She is also a very published author. She has written books including Hashimoto's Thyroiditis, Lifestyle Interventions for Finding and Treating Root Cause, the Hashimoto Protocol, which is literally one of my most favorite books. So when I have practitioners who reach out on DM and they're like, "I want to be just like you. Like, where do I start?" I'm like, "This you need to start here." So I think it's such a good, with even just beyond Hashimoto's, I think it's a good foundational book on approaching autoimmunity, because a lot of times it's all very similar root causes. So if you fix one thing, you're going to fix some other things with it. She's also written a book called Hashimoto's Food Pharmacology, and then the Adrenal Transformation Protocol, which I also think is a really good book, especially in this day and age. We have so many people who go all the time, and they're not really supporting their adrenal function. So I think that's all good stuff. She also founded a supplement company called Rootcology, which has a lot of really good quality supplements for adrenals, thyroid support, hormone support, all these things. She's a huge advocate and huge educator when it comes to kind of some of the myths and misconceptions when it comes to thyroid management, as well as getting a proper diagnosis, advanced testing, which I think here in integrative medicine, we really, I think, can do a good job of looking more at up and downstream effects of root cause, and then the lifestyle piece. So I always say in our practice, anyone can kind of take a pill, but the hard stuff comes in. You got to do the homework outside of this appointment. So when we get to the appointment, I can see all the success you've done. So welcome. We're so excited to have you on our podcast today. So Isabel, are you ready?
I'm ready. I'm so excited to be here with you, Lexi.
Yay. So let's talk first on a little bit of your training as a pharmacist. So I think you're so unique in so many different ways. Tell me, why pharmacy? And then kind of let's talk a little bit about, your transition from conventional into the integrative space.
Ooh, I don't think anybody's asked me that. So I always knew that I wanted to help people with their health. I grew up in Poland and my mom was a physician. And I just always knew that's what I wanted to do, something very similar to what she did, except I didn't really like blood or needles. So I would like faint at the sight of blood. And then sometime in high school, I really discovered chemistry and I got really interested in pharmacology. One of my mentors in high school introduced me to a local pharmacist. I also got to shadow a local pharmacist. I got to shadow a local psychiatrist, some social workers. I really knew that I wanted to be in the healing professions, just not in the blood and needles type.
Fair.
And so, yeah, so then I ended up really falling in love with pharmacy. I really wanted to find a cure for a condition. I thought it was going to be like a pill. Like I was going to invent the next drug, right? The next drug to heal something. It didn't quite turn out that way, right? Going through pharmacy school, I was very passionate about pharmacy. I was very passionate about medication use. And then I started to learn more about like the physiology and some of the lifestyle changes that we can utilize, for example, for diabetes to make ourselves healthier. And then I kind of was like, oh man, when people come to the pharmacy, I'm sort of like catching them when they've been sick for a while and they need medications. What if I were able to reach people earlier, like,
Right.
and tell them on how to make themselves healthier? And this was kind of like a thought I had in my mind, right? Meanwhile, I was like exhausted. I had irritable bowel syndrome. I had all kinds of symptoms that my doctor was like, well, you're in grad school. Of course, you're going to be stressed. How many hours are you sleeping? How many hours are you studying? What kind of crap are you eating? It was like 100% ramen noodle diet for
Yeah.
for quite some time. And it wasn't really until I was diagnosed myself with Hashimoto's after being already a practicing pharmacist
Right.
where I was like, okay, So I could take medicine. This is really exciting because maybe this will be helpful for me for all of the darn symptoms I've been having. So I had like chronic fatigue, acid reflux, irritable bowel syndrome, carpal tunnel, anxiety, panic
Oh,
attacks,
wow.
hair loss, just like a long list of
Yeah.
symptoms in my 20s. I think I was 25 years old and I was asking my practitioners what's going on with me, and they would say, "Oh, well, you're just getting older," or they would test me and say every all of your labs
Right.
look fine.
Right.
And finally, I sought the advice of somebody that was a little bit more comprehensive, and I was found to have really high thyroid antibodies. My TPO antibodies were in the 2000 plus range. Sure we'll get into those.
Yeah.
And subclinical hypothyroidism. And at that point, I was like not really a candidate for medication, according to my practitioners at the time. And I'm sure we'll get into some of the controversies about that. And I
Right.
wanted to figure out if there was anything I can do from a lifestyle
Hmm.
standpoint to make myself feel better, because I went back to my pharmacy school notes and it was like, if you have diabetes, you can change your diet and exercise. If you have hypothyroidism, you take your medications. And I was like,
Yeah.
well, I exercise, I eat whole grains, I eat low fat dairy. And I thought I was trying to lead a healthy lifestyle. I would exercise like 5 days a week and do all the things. And I ended up really taking a deep dive into PubMed, patient forums, into working with integrative practitioners, just in trying to heal myself.
Sure.
So I always joke I became a thyroid expert by ways of being like a guinea pig.
Yeah. Oh, absolutely. Yeah. Yeah. No, I think that is so many people, so many of the great minds, who come to functional medicine like Dr. Walls and, MS and Dr. Hyman and his autoimmune stuff. Like so many people have such a personal story to it. And I truly feel like it's what makes them such great practitioners because you've been in that chair. You've been told everything is fine. And I feel like, especially as women, we're great at rationalizing why we feel like crap. Like we're so good at it, but it's like, no, 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 there's really something wrong with you, kind of thing. So I mean, I think it's such a common story that we hear, and that you have your own personal, like, I got to figure myself out kind of thing. So let's talk a little bit about the difference, or can you help us differentiate the difference between just normal subclinical hypothyroidism and like how is Hashimoto's different, and why is it unfortunately a lot of times overlooked?
So the interesting thing about Hashimoto's, it is a progressive autoimmune condition, and there are multiple stages, 5 stages to be exact. The first stage is essentially just the predisposition to have it. Perhaps you have some family members and it might be in your genetics. The second stage, you start having this autoimmune attack against your thyroid gland. And at this stage, typically your thyroid function is still normal. And so, for all intents and purposes, if a doctor were to do a traditional test like a TSH test, that test might be normal. If they test thyroid hormones, free T3, free T4, whatever, those might be normal as well. But what they might see if they do test is they might see thyroid antibodies. The thyroid antibodies most commonly associated with autoimmune hypothyroidism are going to be TPO antibodies and TG antibodies, thyroid peroxidase, thyroglobulin. You guys don't need to know that. If you're listening to that, your practitioner will know exactly what that means. But in this second stage of Hashimoto's, people can already be symptomatic and they can have multiple miscarriages. They can have anxiety, panic attacks. They can have mood disorders, and just an overall feeling of unwell is what people will say, like, I just don't feel good. I'm more tired, something is going on. And, that something is an autoimmune attack against your thyroid. Stage 3 Hashimoto's is when you start having, this attack against your thyroid has gone on long enough where the thyroid gland is no longer able to properly compensate for thyroid hormone production. So you start seeing the TSH, it's a pituitary hormone, begins to rise because the body's like, okay, something's off. We need to make more thyroid hormone. And so in the early stages of subclinical hypothyroidism, a person will still have those normal T4, T3 hormones, and their TSH might be anywhere from, it's a bit controversial what the numbers might be, but I would say up to 10. is
Yeah.
where their TSH might be, and the T3 and T4 might still be normal. This is when I was diagnosed, and I was super symptomatic, and I had, carpal tunnel. I was exhausted. I was like a sloth. And most doctors will say, like, you do not need to take thyroid medications at that point. You only need to take thyroid meds if you are perhaps trying to conceive. And they have a list of reasons why, but for most patients, they might actually decline giving them medications. The other progressive part of that is stage 4 of hypothyroidism. This is when the thyroid gland fully loses its ability to compensate for the autoimmune attack. And so a person will have an elevated TSH and their T4 and T3 is going to be too low. This is where most people actually get diagnosed. And by that point, their immune system has done quite a job on their thyroid gland, and their thyroid gland is going to be, very much damaged. This is the point where most practitioners will prescribe medications. However, it doesn't stop there. Stage 5 of Hashimoto's is progression to other autoimmune conditions. And so I'm a big proponent of like testing those thyroid antibodies because they can be elevated for 10 years before you see a change in TSH. And I'm also a proponent of measuring them and doing lifestyle interventions to slow down or stop that progression to other autoimmune conditions. And generally speaking, people feel better when we do address their thyroid antibodies. So we're looking for getting those thyroid antibodies under control, getting the symptoms under control, in addition to optimizing the thyroid hormones when there's a thyroid patient. And I think one important consideration is most people don't know that they have Hashimoto's. They just might be told that they have a sluggish thyroid or they're hypothyroid. And Hashimoto's accounts for more than 90%. I would say some studies are saying 97% of cases of
Wow.
hypothyroidism in the US.
Yeah. Yeah, no, I would absolutely believe that. So I think it's important to differentiate that you can present with negative antibodies, but develop it still down the road, right? And so, we'll often hear patients say like, "Well, my endo checked it once and never checked it again," and it's like, well, I don't know if I necessarily believe in that, only because we are working on cleaning up their gut, trying to remove gluten out of their diet, support them with good nutraceuticals, and it's really cool to kind of see like, look at, and I've had patients where they go from TPO antibodies 500 to non-detectable
Amazing.
non-detectable, which is amazing, right? And so I always try to explain to patients like this helps me kind of understand like where do we need to really kind of focus our efforts. So I think you put it so well, so well. So let's talk a little bit about maybe some of the root causes of Hashimoto's. And this is where I really feel like the first book that you wrote, I feel like is so enlightening to patients and practitioners. Because if you understand the root cause, then you can understand it's beyond just taking a pill. It's focusing on sleep and exercise and movement and getting gluten out of your diet and all these other things. So can you talk a little bit about some of the autoimmune triggers and kind of the triad of autoimmunity, please?
Of course. Yeah, the most common triggers I've seen are going to be food sensitivities. Typically, gluten, dairy, and soy are some of the big ones to start with. Nutrient deficiencies, oftentimes B12, vitamin D, ferritin, but also like thiamine, magnesium, selenium. A few of these other nutrients are important. Then we're looking at impaired stress response. So typically, this might be a person because they're sleep deprived, overworked, maybe they have a history of trauma, some blood sugar swings. I do love to focus on adrenals as well. We also have a lot of times gut inflammation. This could be due to chronic infections in many cases, and also an impaired detox system. Typically, they might have there's like so many chemicals that have been associated with causing thyroid damage or thyroid autoimmunity. It's like it's really hard to keep track of because every other month something comes out about, okay, fluoride can be a thyroid toxin, then we have BPA, then we have triclosan. And really at the root of that, in my experience, is like we need to support our detox pathways because we live in a pretty toxic world. And the other common thing that people, I think, may not realize, and I know I had brought this up to an endocrinologist once, and he kind of looked at me puzzled, is that every case of autoimmune disease has intestinal permeability associated with it, which is leaky gut. This is published in like the gastroenterology medical journals, but apparently, like most endos don't read those. And so there is this triad of autoimmunity. This was developed by Dr. Alessio Fasano, and all of us in functional medicine know it, right? And so it's going to be you have the genetic predisposition, you have some kind of a trigger, maybe it's a toxin, maybe it's an infection. We're not sure, we're not always sure what the trigger might be. And then the third part of it is that intestinal permeability. And so the way that I think about it is like you can't change genes. We might get to a point where we could like edit our genes. Like that would be amazing at some point in the future. We're not quite there yet. We don't always know the trigger that has occurred. We can definitely try to eliminate some of our triggers, and
Sure.
we do work towards that, but we can always work on making the gut less permeable. And a lot of times that includes nutrients, food sensitivities, our stress response, and also looking if at whether or not we have some of those chronic gut infections that are really, really notorious for driving that intestinal permeability.
Yeah, absolutely. I think too the important piece as a practitioner is when you're taking that history, like you need to ask some of those questions, like any family history of autoimmunity. What's hard though is that I feel like it's not super common to check people like in history. And so I feel like more so recently, if especially if you're seeing an integrated provider, you're more likely to be checked for it. So sometimes people don't know, like, well, Aunt Alice had some weird thyroid thing, but nobody knows what Aunt Alice had, and it could have been an autoimmune, condition. I think the other thing that's hard with is we always say genetics loads the gun, but lifestyle pulls the trigger. And it's like, here are all the really cool things that I can kind of help you do, and supporting detox and getting good selenium in, and like doing all the things that we need to like help the process along, I think is so important. So let's talk a little bit about common symptoms, and then like the diagnostic piece of it, because it's more than just looking at a TSH. So symptom wise, like listen, I remember from reading your book, I'm like, this poor girl just like went through the ringer with all the symptoms. So I think there's some really typical, and then I think there's some like atypical, but that is still part of it. So do you want to kind of share a little bit about, what some of the symptoms that you typically will see?
Of course. And so I like to think back of a picture from one of my classes in pharmacy school, and they had this woman who was cut in half, right? And half of her had an overactive thyroid, and the other had an underactive thyroid. And so you can see symptoms like hair loss, brain fog, fatigue, depression. You're going to have weight gain, menstrual irregularities, potentially fertility issues, joint pain, just kind of an overall sluggishness when you have hypothyroidism. A big kind of red flag is cold intolerance. When you're just like colder than the average person. I know I used to like go into my office and everybody was like in short sleeves and I'd be wearing like a jacket and a scarf. And the other big red flag is if you lose the upper third of your eyebrows, and not because your friend plucked them for you, like that can happen sometimes, but just spontaneously losing the upper third part of your eyebrows, that's a classical hypothyroid symptom. Now, with overactive thyroid, typically we think of, okay, a person might have palpitations, they might have some eyeball protrusion, they might have some anxiety, they might have um, some weight loss, irritability, so on and so forth. And the tricky part is in Hashimoto's, sometimes you might present with both, right? So you might present with anxiety, panic attacks, hair loss, weight loss, and then you might actually be hypothyroid. And this is because in the early stages, when this autoimmune attack starts to go against your thyroid gland, you're going to have bits of thyroid hormone that gets dumped into your bloodstream. So you can absolutely be somebody that's hypothyroid and you might have palpitations, you might have anxiety, and you might have some of these other symptoms that might be more classical hyperthyroidism or overactive thyroid. And I think that's important for practitioners to consider, is to make sure that they run a full thyroid panel, which to me is not just TSH. I know a lot of times people will say, okay, I go to, speaking of ants, I'll go to visit my aunts in Poland and I'll be like, "Auntie, why are you wearing like this huge jacket? It's so warm outside. Have you had your thyroid tested?" And they'll show me their labs and it'll be like TSH. And I'll be like, okay, you need to do these additional labs because a lot of times doctors might not do the comprehensive testing. So, TSH, of course, we do need. This is the thyroid stimulating hormone. Again, remembering that this can be normal in the first 5 to 10 years when somebody has a thyroid condition. And depending on when you measure it, it might fluctuate. The reference ranges are also, have been historically overly lax. Then we're looking at the thyroid hormones. So, what's actually happening? Do we have enough of these hormones circulating? Free T3 and free T4 is what I typically like to use. Thyroid antibodies, TPO and TG are the most common ones in Hashimoto's. And then I know a lot of people do love to utilize reverse T3. This can be very, very helpful for figuring out if there's something else that's preventing you from properly utilizing thyroid hormones. Typically, I'm always like, is it ferritin or is it adrenals? Usually it's one of those two things. And then um, I think you had mentioned some people may not actually have thyroid antibodies, but they might have all the symptoms. And what do you do then? So you may want to look into doing a thyroid ultrasound. There are people that have something that's called seronegative Hashimoto's, which is like they have Hashimoto's and they have this attack on their thyroid gland, but for whatever reason, they're not testing positive for the antibodies in the blood.
Yeah.
And then there's also looking at, adrenal function, because sometimes in some cases it can be the adrenals that really slow down the thyroid gland.
Yeah. I think the other thing too, I think it's so important to check all those thyroid pieces because there's certain supplements that can change a TSH, and so in our practice, we do a lot of functional medicine, gut testing, all those things. And then we also have like an aesthetic side of it. And so we have a lot of women who take, Nutrafol for their hair, which has a high level of biotin, and so then when I get like a weird thyroid level back, I'm like, what are you on? Like supplement wise, I think that's a big thing, and I think one of the questions that I was going to ask is I feel like there's a lot of controversy when it comes to iodine. Like iodine can be so great for some patients, and then iodine can be not so great for some patients. Like, how would you describe like how iodine can impact the TSH?
It's very interesting. So I've seen people who have done really well with it, where they were like, this was the missing piece, and this turned my health around. And then I've also seen people who were like subclinical hypothyroid with, let's say, thyroid antibodies at around 100. Maybe their TSH was at like 6 or 7, and they took high doses of iodine, and then they ended up with like 1,000+ antibodies and really high TSH and became like really debilitated from a symptom standpoint. Where initially they were kind of like, well, I'm a little bit tired. I'm just trying to be more proactive. And they'll say, I got more energy at first from this high dose iodine thing I found on the internet. And then, holy cow, then I really came crashing. And to me, I treat it's a narrow therapeutic index nutrient. And so I treat it with a lot of caution and respect. So
Sure.
you can absolutely be deficient in iodine, and that can cause a lot of issues. The dosages that I typically like to work with are going to be what you can find in like a prenatal vitamin or a multivitamin, anywhere from like 150 micrograms to 300 micrograms. The research has shown that those are safe and effective in people with thyroid antibodies. And so they can help you feel better and they can actually even reduce thyroid antibodies. When we go above like the 500 microgram range, the research is showing that can actually increase thyroid autoimmunity. And not for everybody, but for me, I'm just like, I'm not going to risk that. There's also other parts of I guess, the equation that you need to balance. So, for example, if you're selenium deficient and iodine deficient, taking iodine can propel the autoimmune destruction against your thyroid gland. There are people that I've worked with have like raging gut issues. And it's like just giving them iodine is kind of like telling somebody to run on a broken leg. Like, let's fix your gut first so that you're properly absorbing nutrients rather
Sure.
than doing that. So, my approach is very conservative with it. I have had some people who were like clearly overdosed themselves where I'm like, okay, we're going to like minimize your iodine intake. We're going to go under 100 micrograms a day to try to get a reset. And then there are people that I'm like, okay, well, maybe we can, work with getting you on a bit of a higher dosage once everything is really balanced. But for the most part, it's like, I wish it was like, some people are like, just take iodine if you have a thyroid issue. I wish it was that easy. Like,
Yeah.
I would have just done that, right?
Yeah. And I think what's so hard too is like social media is great, like it's a great way, free way to educate patients and things like that. Unfortunately, it's hard for patients as a consumer to see like, okay, like the person who's recommending this much iodine for everyone, like, do they treat patients? What kind of credentials do they have? Are they monitoring blood values? Because I feel like I get that a lot. Patients come in again, like my patients are really health conscious. They like to read, they like to listen to podcasts. And so I feel like sometimes I'm like, okay, I don't necessarily agree with what this is. And then I, find out who the person was. And I'm like, I don't know if they like actually look at blood work and treat patients per se, or they're, just recommending a supplement to recommend a supplement kind of thing. So it almost makes the waters a little muddy sometimes as for patients who are trying to stay educated on things. Speaking back to the labs, if someone is on like prescription, what do you tell them as far as like taking the labs? Do you hold the dose the morning of? Do you try to get it 4 to 6 hours after taking it? Like what is your kind of recommendation as far as when to draw the labs?
For me, what I've looked at the pharmacology and the pharmacokinetics of the T3 half-life and the
Yeah.
peak and the T4 peak. And what I found, and I've had a couple of clients. So for most people, I don't think it matters as much, but I've had a couple of clients who were on like Armor or natural desiccated thyroid or a T3 containing med, where they would take their meds and then do their labs sometime after, and they looked over medicated.
Yeah.
And so their doctors kind of would get really nervous and they'd be like,
Yeah.
let's take you down. And they'd develop all kinds of symptoms. So to be safe, I generally recommend take your meds with you to the lab. Don't take them, like take the bottle with you. Do the lab draw first thing in the morning. And right after you do the lab draw, then take your meds right after. Just because in some cases it can, like,
Right.
depending on how you time it, if it's like at the peak, that can really impact your T3 levels and your TSH levels if you're taking T3 medications. Now, I
Okay.
know different practitioners, I've seen different practitioners recommend all kinds of things,
Sure.
but this is how I've always done it. And I have seen people and
Right.
myself too, when I'm like, I've forgotten to skip my meds that day. And I'll be like, why is my TSH so low? Right.
Yeah.
It can absolutely impact that.
Yeah, well, absolutely. And I think what's hard, so in our practice, again, we do a lot of integrative medicine, and then we are not their primary, like they have their own primary. And so the patient will be in our patient portal and they're like, my doctor wanted me to let you know that my TSH was this. And I'm like, had you taken your meds that morning? And they're like, well, yeah. And I'm like, okay, well, I will recheck it. But I actually, the way that we do it is especially if they're on T3, I want it like 6 hours after. I want labs drawn 6 hours after they've taken their T3, so it gives it time to like peak and start to
Yeah.
come down a little bit. Then when I recheck it, I'm like, here, share this with your primary to let them know I'm not over medicating you. And I think the important thing too, as a practitioner, is explain to the patients, here are the signs and symptoms of an overtreated thyroid. If at any point, if I'm not, we're not due for an appointment, jitteriness, heart palpitation, anxiety coming out of nowhere, your hair's falling out, you're sweating, a lot of those things, then you need to let me know. You hold the dose, call me. That's, we got to do something. So I think that's the other piece of it is I sometimes feel like, which I like Armor and I like NP Thyroid, I sometimes feel like they almost get a bad rap because because on blood work they don't behave well sometimes. And then, again, it's really important to have that close follow-up with a patient. And so again, this is it where we're different. In traditional medicine, they may check a TSH once a year and be like, okay, stay on your levo. And it's like, there's some other kind of stuff going on there. What are your thoughts about, there's some different schools of thought. There's some practitioners who don't care about a suppressed TSH. And then, there are some practitioners who like overemphasize the TSH. Not so much, I feel like, in the integrative world. I think what I always go back to is how does that look in court, or how are you going to defend yourself? For me, I'm a nurse practitioner, so the board of nursing is, did you follow the standard of care kind of thing? And so I think that can, also be hard, because when you're dealing with autoimmune patients, like the wind blew a weird way and now their TSH is doing something weird, so like, how would you maybe advise, a practitioner as far as if they're riding low with a TSH? Like, do you get nervous? Do you do more labs? Like, how would you approach that?
Yeah, I tend to be more conservative with things like that. As a pharmacist, I kind of, pharmacists are known to be like rule followers, right? And
Right.
so I tend to try to keep it between like point 0.5 and 2. If
Mhm.
I'm working with somebody, I'm like, this is where most people feel their best. Of course, there are going to be people that maybe are the unicorns that need a suppressed TSH. But in my experience, I'm working with them so much on the lifestyle component of it that I think some practitioners are like, "You're tired, let's give you more thyroid hormone." And I'm not immediately thinking that. If I see a TSH between point 0.5 and 2 and you're still tired, I'm not thinking, "Let's give you more thyroid hormone." I'm thinking, "Have we checked your ferritin?" I'm
Right.
thinking, "Can we get you optimized there?" Because sometimes that can turn your fatigue around. I'm thinking, "Have you tried benfotiamine?" Because that can turn your fatigue around in 3 days. If, have you tested your adrenals? So I typically, I tend to be like, try to get the TSH dialed in right in that, like optimal reference range that's not too high and not too low. And then look at other reasons why somebody might be symptomatic.
Yes.
But I know if there are people that may require those higher dosages and whatnot. I guess one part about the dosing, I might look at something like a tyrosine or something for a reason why they might not be absorbing their medication. And the other thing, I was just document and talk
Yes.
about what kind of symptoms they were having, and if they really did need to be on a higher dosage of thyroid meds. But honestly, in my experience, a lot of people come to me for not the meds. They come to me for,
The lives.
ironically, I'm a pharmacist, but they come to me for everything else, right?
Yeah. 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 No, absolutely. And it's so good to hear you say that. The range that I follow is the point 5 to 2. I try to keep patients in that range. And then the other thing that I think practitioners will reach out and they'll say, their TSH is low, but so is their free T3. So it's like, so what does that mean? And I tell them there's something else going on. You need to look at, like, where are their metabolites, where's their cortisol? Did you check a reverse T3? That's going to give you some insight. Like, there's something else there that, like, the signals aren't signaling. And so you have to look a little deeper, because it's not just a bunch of if then statements, right? Like, they call it the art of medicine for a reason. And I think the correlation between a free T3, a TSH, and a reverse T3, I think, can give you a lot of insight as to, like, thyroid, brain, pituitary, peripheral conversion, like what is going on here. So it's not as simple as put everybody on Levo or everybody on, Armor. Like, there's a lot more that goes into it. So let's say, for example, you have someone, with Hashimoto's disease. Do you feel like everybody eventually has to get on thyroid medicine, or have you seen that patients can maybe manage more with lifestyle, diet, nutraceuticals?
I'm a big proponent of taking medications when you do need to take them. And so oftentimes people come to me and they might say, I don't ever want to take medications, but if their TSH is significantly elevated, then I'll be advocating for them to, like, hey, you're having a lot of symptoms. Let's get you feeling better. There are some people who I would say in the subclinical stages that we can get them normalized. Some of the, I guess, case studies I would have for that would include people who had celiac disease and they went gluten free and, like, holy cow, all of my symptoms disappear. It's, obviously that's not the case with everybody, but there's those situations when even they've had thyroid disease for quite some time and been on thyroid medications and they become over medicated. The other patients, in my experience, with selenium and myo-inositol, that combination, some patients have been able to normalize their TSH and get their thyroid antibodies into remission. Let's see what other case studies. H. pylori treatments or treating some kind of infections. I've seen a big dosage reduction in medication with those. I've had some people who were misdiagnosed misdiagnosed and maybe over medicated where we just supported their adrenals properly. And that has turned things around where all of a sudden their numbers are perfect without thyroid meds.
Right.
Let's see, low level laser therapy that's been helpful for some of my clients. I will say it's not something I promise to people where it's not like they come to work with me and I'm like, we're going to get you off of thyroid meds. Like my goal is always to help them feel their best. And that does include thyroid meds. But in some cases, some people have been able to wean off of them or not need them. And I would say, generally speaking, if you're postpartum thyroiditis, you're going to have a higher chance of that. And if you're subclinical hypothyroid, you have a better chance of that. Celiac, these were some of the more common ones that I've seen.
Yeah. No, I completely agree. This is such a good question. If you had 3 dietary kind of shifts, someone with a new diagnosis of Hashi makes that you feel like make a big impact, what would they be?
The gluten-free diet can be a really big game changer, even if you don't have celiac disease. In my experience, about 88% of the people that I've worked with and done some surveys with feel better gluten-free. The other big change is a dairy-free diet. And I know I hate to tell people that because everybody loves their ice cream and cheese. About 80% of people feel better dairy-free.
Mhm.
I I think that can be reversed, the dairy sensitivity, much easier than the gluten sensitivity. And then the third thing would be blood sugar balance.
Mm.
Typically speaking, more protein and fat than the standard American diet, and just really focusing on getting blood sugar balance because whenever we have these blood sugar swings, that can really set off our thyroid antibodies and mood swings, anxiety, hypoglycemia, reactive hypoglycemia. This is like a really big deal of what
Yeah.
I see in people with Hashimoto's, and oftentimes like that blood sugar balance piece. It's like, oh my gosh, I have more energy and
Right.
I'm less anxious and I feel so much better. And that's just like we did more protein and more fat than the
Yeah.
standard,
Well,
right?
that's good. I would say we're similar 2 out of the 3. I say gluten, dairy, and alcohol. So that's usually
Oh,
it's usually my 3 and they're like, because it's real black and white, gluten, dairy, alcohol. But no, it's good. It's good. Shifting gears a little bit into the gut. One of the biggest things that I have, learned in the training through the IFM and functional medicine is literally everything starts in the gut. Everything starts in the gut, everything converts in the gut, everything, assimilates in the gut. And so let's talk a little bit about what role does gut health play when it comes to thyroid support and thyroid function?
gosh, so interestingly, like the thyroid gland and the gut tissue are have the same like fetal origin, but we do know that there's a big connection with autoimmunity and intestinal permeability. So I typically work on the gut for most people to try to get them to feel better and to try to get their autoimmune markers to go down. Few different gut infections have been um, correlated with Hashimoto's. H. pylori and some protozoal infections are some of the more common ones I see. When we treat them, we can see the rates of thyroid antibodies going down, and we can see people's symptoms improving. Sometimes their TSH might improve as well. Then, of course, we know that the thyroid gland has an actual impact on gut motility as well. So it's kind of like a two-way street. Like gut infections can make your thyroid worse, but your thyroid being underactive can actually make your gut function worse. So typically the consequences of like dysthyroidism on the gut, these might include low stomach acid. And so a lot of times people will have acid reflux because they're not digesting their food properly. This is a consequence of hypothyroidism. Even subclinical, even those thyroid antibodies can result in that. Then we have just an overall slowing down of digestion. So people might be constipated. Some
Right.
people might have diarrhea, depending on if they're having, those swings of thyroid fluctuations in the early stages. Interestingly, like I feel like 20 or 30% of people, I'll have to look up the stats of a small study of people with IBS actually had subclinical hypothyroidism. And then the other component is small intestinal bacterial overgrowth. When our gut motility slows down because of hypothyroidism, then we are at greater risk for SIBO, where we overgrow bacteria in the small intestine. And that can make us depleted in iron, in B12, make us super bloated, and lead to things like even restless leg syndrome. And this can be kind of a vicious cycle because it's like you're perpetuating the, the SIBO can be perpetuating the intestinal permeability. And so in my experience, I found like you have to like correct the triggers that caused the hypothyroidism. You have to correct the thyroid hormone, and then you have to correct the consequences of like being hypothyroid. Cause like when you're hypothyroid, so many things don't work properly.
Yes. No, absolutely. Um, Out of curiosity, can you explain? So, one of my favorite probiotics to use with Hashimoto's patients is Saccharomyces boulardii, for a lot of reasons. Can you articulate, please, why it's such a good probiotic in your Hashimoto's patients?
Oh my gosh, I love it so much. I don't even know where to start, but I'll try. So, Saccharomyces boulardii is a beneficial yeast, and one of the things that it does is it boosts our secretory IgA, which is our gut's defense system. And so in some cases, you can just take Saccharomyces boulardii to like really clean out your gut. And that might be from protozoal infections. Protozoal infections can contribute to a ton of different symptoms. And just taking Saccharomyces boulardii can clear them out. It can be used as an adjunct with other infections. For example, H. pylori, if you're taking like triple therapy and you take Saccharomyces boulardii, then you're going to clear the infection better and you're less likely to suffer consequences. So it could be used for recovering from antibiotic use. It could be used for candida. It could be used for mold. And it's also safe in SIBO. There are some probiotics that can exacerbate SIBO. I know this is controversial,
Right.
but I know from when I see a client and they're like, this probiotic makes me feel like crap, I'm not going to argue with them about the controversies of that. But Saccharomyces boulardii is generally very well tolerated in SIBO. And so it's just like one little beneficial yeast, and it doesn't get killed off by antibiotics. It just doesn't colonize your gut. It just sort of cleans it up.
Yeah.
So it's like having a little cleanup crew.
Yeah. No, it's great. I think the biggest thing that when I'm doing a GI, so we do GI map testing. That's like how we look at our gut test. Is their secretory IgA? I'm like, okay, your first line of immune defense is really low. So I call like thunder and lightning. We'll pair like a little bit of colostrum with a little bit of fluoromyces, and it's like, okay, this is gonna like get your soldiers kind of like built up a little bit. And then we also use some peptides as well for the gut. But yeah, that I think that was probably one of the biggest things I had learned early on, probably with one of your books, is utilizing a probiotic like Flora or Saccharomyces boulardii is a great option. One thing that I'd like to kind of go back to, I had the question in my mind, and I was like, I need to ask her this. Can you help explain the difference? I always say, if I was stranded on an island and I could only take like one thyroid prescription with me, I would actually take Terracent. Because I'm like, it's like the Louis Vuitton of thyroid medicines. It plays nice with everybody. It's gluten-free, dairy-free. It's absorbed well in the gut. It's a capsule. You can take it with, like, I'm like just talking it up, right? Can you articulate like how is that different than your generic levothyroxine that you get at your regular pharmacy? You're
Oh my
like,
gosh.
wow, these questions are just rapid fire.
That that's such a great question. And when I went to pharmacy school, we learned that thyroid hormones interact with everything. Like every single drug, you have to space out from thyroid hormones. And it's not because, for there's various types of drug interactions, and some of them are because of the liver and how they're metabolized. But these interactions are oftentimes due to like absorption. And so you can't have your thyroid meds with coffee, right? Because that can impair their absorption. Well, the wise Italian researchers who developed Tyrosint were like, we have our patients that love to sip on espressos first thing in the morning, and they're not feeling well with their thyroid meds. And so they'd formulated this gel cap that absorbs really, really well. And so you can sip on coffee. You can have a raging H. pylori infection. You can take calcium, whatever, with your thyroid meds, and it doesn't interfere with the absorption. The generic ones, levothyroxine, you can have a person drinking coffee 2, 3, 4 hours after that, and that might impact their absorption. if a person has H. pylori, if they have gastritis, if they have low stomach acid, if they have high stomach acid, it's kind of like, if they take this supplement too close, it's
Yeah.
like if they eat too
So
close, if
so
they drink
pes
too close.
yeah, it's so finicky.
Yeah. Did I give you a little bit TMI?
Oh, no. Like that, like I wanted the whole listening world to know, like you have to take if you're on Levo. But like I said, I transitioned tons and tons of my patients to Tirosint, and I wanted them to kind of like hear this is the thought process behind why we do that. The other great thing is, like a lot of times when I write for it, I have to do a prior authorization, to try to go through insurance. So I feel like nowadays so many people have like high deductible insurance, which, being a small business owner, I totally get that. But it's actually on Cost Plus, which is great. So Cost Plus is it's kind of like a direct to consumer. There's not like a lot of markup on it, which is great, So it does make it a great affordable option. And I would say the other thing that I would oftentimes too see that when I get new patients, and they're on levothyroxine, is that they're not even on like weight appropriate base dosing. Like 1.6 mics per kilogram is the dose. And I'm like calculating it out. I'm like, you're on 100. Your weight-based dosing needs to be like 175. And so I think like just like that can make a huge difference. So like in order of operations, patient comes in and like their thyroid's disastrous and they're not feeling good. Is I'm like, number one, do we change you from generic to brand name? Because sometimes that can be a huge help. Making sure
Mhm.
that their dosing is appropriate, 1.6 micrograms per kilogram. And then I would say the third thing is we did all that, you need the bougie stuff. So let's just jump to Tirosint. And usually one of those things have kind of like fixed while I'm working on their gut and their lifestyle and their other hormones and things like that. So I think that's really important. If you're a Hashimoto's patient and you're listening and you're like feeling like I'm on this med and they changed this dose, but there's other options. They just need to kind of like dig a little deeper, or kind of open up the toolbox a little bit more. Okay, I got another question. It's not on the question list, but I'm like these things are just flowing. Let's talk a little bit about low dose naltrexone, LDN. We use this a ton in our practice. So that like literally could be a whole podcast on itself. But can you talk a little bit about, like how that can help in your Hashimoto's patients?
My gosh. So low-dose naltrexone is one of these like hidden gems, and it could work really incredibly well for some people. I would say about half of the people that I've worked with, they have incredibly amazing results. And then the other half are kind of like, I don't know, am I supposed
Yeah.
to feel different?
Yeah,
Do I
they
feel
don't, they
different?
got nothing. Yeah.
But for some people, it's like it gets their Hashimoto's antibodies into remission. They have a new lease on life and they feel like they just feel human again. I know, one of the ways that it works is through boosting our endorphins. And so some people just feel this huge boost and they feel so much better. Um, some of the side effects, I would say some people have a lot of vivid dreams.
Mhm.
I know when I personally took it, my dreams were like Fabio on a horse dreams, which weren't so bad. But that can be a challenge for some people. So I typically might say you might want to utilize that in the morning. But yeah, I mean, it's not just for Hashimoto's, but any kind of autoimmune disease. Let's say inflammatory bowel disease. There's like two books I think I've endorsed that are just about low dose naltrexone and what it can do. I feel like, with it can help with like addiction, with weight loss. Um, I'm like, I'm trying to think of something that it can't help with. But of course, it's got to be for the right person. Not everybody's
Right.
gonna
Right.
respond
Absolutely.
as well.
And I would say too, more recently, I actually started taking care of a patient, and she's actually a GYN, and I started at my typical protocol starts at about 1.5, and it was actually like almost too much for her. Like the sleep like I got her tracking her sleep scores, and she's like, oh my god, it was like I don't know 50, and normally she's like cruising in the high 80s. So I said, let's start taking it in the morning, the 1.5 in the morning, and then I her at like a point 0.5 before bed, but yeah, it's interesting. So I love it. Sounds like she does too, but for the right patient. And sometimes there's not a perfect protocol. Sometimes you got to start a little bit lower and almost like microdose the low dose, so an even smaller dose. But I think in the right patient, it can be a great, very inexpensive way to help your patients for sure. Let's talk a little bit about maybe your top 5 supplements to support patients. for Hashis?
Oh my goodness. I really love thiamine, and especially the benfotiamine form, about 600 milligrams for thyroid fatigue. Sometimes that could recover fatigue in like 3 to 5 days, and again in the right person. Typically, a person might have low blood pressure. That I am, if they have low blood pressure, I'm like, okay, let's think about thiamine here. The other one is carnitine. So this can be very helpful for brain fog. And whenever I have a person who's dealing with a lot of brain fog and maybe some muscle wasting, they just don't feel as strong. Maybe they're waking up throughout the night. They have a hard time with like fasting or intermittent fasting and whatnot, or dieting. Then I'm thinking about carnitine, getting them on that, about 2,000 milligrams a day. And that's been studied for thyroid fatigue. N-acetylcysteine is fantastic for thyroid antibodies, for detoxification, for symptoms like obsessive compulsive disorder. I love myo-inositol for blood sugar balance, for PCOS, for OCD like symptoms, reducing thyroid antibodies, reducing TSH. What else does it do? It helps with weight loss resistance as well, and PCOS. And number 5 supplement. Let me think about this one. Hmm. I really love doing something like magnesium, right? I feel like that one everybody needs in their life, and it's can help with anxiety, it can help with sleep, cramps. I know I have had ladies with like lifelong menstrual cramps, and after the first month of taking magnesium, they're like, "Oh, wait, I got my period and I wasn't like doubled over in pain. What's going on?"
Right.
So that would be, I think, my top 5, but it's like it's kind of like asking to pick my favorite children. So
I
I
know.
love
I know.
I
I know
love
it's so
different
hard.
supplements.
It's so hard. So hard. All right. So I'm gonna wrap up last kind of little section here that I think is really important. What would you say, like, if you had like 3 misconceptions when it comes to Hashimoto's that you're like, gosh, if this is the hill that I die on, like, what would you what would you say that they are, as far as, what patients think and what the actual reality is?
I think this is an unpopular opinion, but people will say you need to like eat Brazil nuts for their selenium. And I
Hmm,
just haven't seen Brazil nuts like move the needle like a selenium supplement does. It's
okay.
just like, okay. Like I see a big reduction when we actually do use a selenium supplement, and especially combined with myo-inositol versus Brazil nuts. Eat them, don't eat them. I don't really care. Like
Yeah.
they're not going to make that big of a difference. The other thing that I get really frustrated about is that women of childbearing age are not tested for thyroid dysfunction, where having, like thyroid antibodies and even an elevated TSH, even subclinical hypothyroidism can increase the risk of multiple miscarriages. I can't tell you how many ladies I've worked with in their 50s, 60s, and 70s who were never able to have children because their thyroid wasn't cared for properly and they were not tested for it. And I just think that's devastating that women go through so many miscarriages, and everybody trying to get pregnant of childbearing age, like this should just be a standard, right? And then I think some of the myths that I see about thyroid health is like broccoli. Like, don't eat broccoli if you have a thyroid
Yeah.
condition.
Goitrogen.
Yeah.
Yeah,
Yeah.
yeah, no, I definitely agree. Again, it's hard as social media is great, but sometimes I'm like, that's some stupid shit right there. But but yeah, yeah, no, I completely agree. Well, I thank you so much. This was so good. I'm sure this is going to be a very popular episode because so many of the population does struggle with autoimmune Hashimoto's disease, and I think this is a very good kind of insight that patients can easily understand, walk away with like, okay, I think I have a better understanding of what this is. So, Isabella, where can people find you if they want to follow your blog, which is super educational, listen to your podcast? Like, where give us all the details.
Yeah, I have a website called thyroidpharmacist.com. I know, very original, but it's all about thyroid health and
It's
how to
good.
take
I've
care of your
been there a
health.
lot. It's good. It's good.
Thank you so much. My books are on Amazon, wherever fine books are sold as well. And I am going to have a podcast called Thyroid Pharmacist Healing Conversations, and I would love to have you on. I really
Oh, absolutely.
appreciate the work that you're doing for patients with thyroid conditions and autoimmunity, and would love to pick your brain as well and and share with the world on some of the best practices for healing.
Yeah, absolutely. And then your Instagram handle, what is that?
It's
Do you know?
Izabella Wentz Pharm.D.
Yeah.
I might change it to Thyroid Pharmacist. I might not. I'll let you guys know.
Okay. Okay. Well, I'll make sure in the show notes we'll tag all those things. So thank you again for taking the time. Again, if you're a patient and you struggle with Hashimoto's, her book, Hashimoto's Protocol, hands down, probably one of the best. And I've read a lot of books. Hands down, one of my favorite books when it comes to patients who struggle with Hashimoto's, because it's a very good, knowledgeable read. I think I've even read it 2 or 3 times at this point. But cool. Well, thank you again.
Thank you so much. It's been such an honor and a pleasure.